Hi everyone. So just to correct, I'm not a doctor, I'm a PhD candidate. Good morning everyone. My name is Warittha Tieosapjaroen, a PhD candidate at Monash University, Australia. Today I will be talking about what men who have sex with men in 16 countries in the Asia-Pacific region want for pre-exposure prophylaxis of PrEP. Without the team on the list here, we wouldn't be possible to get this study done. It's a lot of effort, so I want to acknowledge the team on the list here. So why do we focus on MSM in the Asia-Pacific region specifically? In 2021, 15.6% of people living with HIV in the world live in the Asia-Pacific region, which was the second greatest number of people living with HIV in the world following sub-Saharan Africa. Another concerning issue is there were 140,000 AIDS-related deaths in the region. There were about 260,000 new HIV infection cases in the regions in 2021, and of those, 46% were gay men who have sex with other men. As you can see, we are way behind to achieve UNAIDS fast-track targets, which is reducing the new HIV infections to fewer than 200,000 per year globally, but in one region, it's already 260,000 new HIV cases. But we can still achieve the target with better approaches to reduce HIV transmission in each region and each population. One of the main HIV prevention method that is effective is PrEP, but to increase PrEP uptake among priority population, we need to understand their need for PrEP service. And that's when we use Discrete choice experiment, or DCE. What is DCE? DCE in theory is an established method for quantifying the strength of preferences. It simulates a real-world situation where respondents are asked to choose between a series of service packages that provide the highest satisfaction or utility. To make it easier for you to understand, here is an example of DCE in our daily life. When people want to buy a phone, they compare specification, prices, and system between different phones, and then they pick the phone that provides them the highest satisfactions. So that is the principle of DCE. So in our study, we use a DCE to evaluate which attributes are the most important driver of choice to use PrEP, and explore the impact of different PrEP service configurations on the uptake of PrEP among MSM living in 16 countries in the Asia-Pacific regions. The result of this study can inform the design of acceptable and desirable services and demonstrate PrEP demand in the local context. So we launched our survey between May to November last year through 4 different channels. Here's the list of the countries that we launched our survey. Here's an example of the DC question from our survey. So each respondent was presented with 6 DC questions, asking them to choose PrEP service program that they prefer more. And they can choose PrEP program A or PrEP program B. Both PrEP programs has the same attributes, which includes such as type of PrEP, service location, and cost. But they have different attributes level. For example, if they choose PrEP program A, they have to pay 25 Australian dollars for PrEP. But if they choose PrEP program B, they can get PrEP for free. But again, they have to consider the whole package and then choose the PrEP service program that they prefer more. Or they can choose to opt out of the survey. Okay. Here are the final attributes and levels for our DCE survey. I will give you 5 seconds to look at all the attributes and select and think and guess which attribute is the most important driver of choice of PrEP for MSM in the Asia-Pacific regions. It could be type of PrEP, service location, cost, side effects, or extra services. Let's see if you can get it right. The result, the answer will be in the result section. Okay, I think everyone get it. Okay. Inclusion criteria. We included MSM who were at least 18 years old, had no prior HIV diagnosis, who live in the included countries, and self-identify as gay, bisexual, and other men who have sex with men. We use random parameter logic or RPL model to estimate the relative importance of attributes for each country and predict PrEP uptake, comparing different PrEP programs. So we compare the worst, best, and status quo PrEP program. The worst case composed of attributes level least wanted, base program composed of attributes level most wanted, and status quo composed of attributes level currently offered. And we also use the same model with interaction to explore the heterogeneity of preferences of those who would most benefit from PrEP. In total, we included almost 22,000 MSM. From 16 countries in the Asia-Pacific regions. Just to mention, this is the largest DC in the world currently, so far. The mean age of the participant was 32 years old. 2/3 of the participants were from low-middle income Asian countries, and about half of them never took PrEP, and less than 20% of the participants were currently taking PrEP at the time of completing the survey. Here is the DC result. I think maybe everyone get it right. Cost was the most important driver of choice of PrEP for men who have sex with men in the Asia-Pacific regions, followed by type of PrEP and side effects. This is another result that I want to highlight. MSM at high risk of HIV infection were more willing to use PrEP if PrEP was provided for free. And when we compare preferences for PrEP between MSM from low-middle income and high-income countries, we found that MSM from high-income Asian countries were more willing to use PrEP if PrEP was provided for free, while MSM from low-middle income Asian countries were more willing to use PrEP if an STI testing was offered as an extra service. In this slide, I want to show you the uptake of the worst and best PrEP service packages. So the worst PrEP service package resulted in less than 72% uptake of PrEP, and this could improve to almost 100% uptake with the best PrEP service program. And the best PrEP service program across the whole Asia-Pacific regions included free PrEP with no side effects, while accessing PrEP through service location once a year, and having an STI testing as an extra service. And MSM in Asian countries preferred on-demand PrEP and accessing PrEP through peer-led community clinic, while MSM in Australia prefer long-acting oral PrEP and accessing PrEP through a pharmacy. And last thing I want to highlight on this slide, people from MSM in the Asia-Pacific region dislike implant PrEP and accessing PrEP to hospital or STI clinic. We provide all the detail about the best and worst PrEP service program for each country, but I won't be able to go through all of them today. But if you're interested, feel free to email me or come and chat with us. Key takeaway, cost was the most important driver of PrEP use among MSM across countries in the Asia-Pacific regions. MSM who were more vulnerable to HIV acquisition were more likely to use PrEP if it was provided for free. The best PrEP service configurations across the whole regions included free PrEP with no side effects and being offered an STI testing as an extra service. Lastly, MSM in Asian countries prefer on-demand PrEP and peer-led community clinic as a service location. Thank you.